Hi everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. I'm excited to bring you another in our series of interviews with top leaders in health IT. And today we're here with Susan Selinsky. She's co-founder and chief growth officer at Ellipsis Health. Welcome, Susan.
Thank you, John, and thank you for having me here. And huge thanks for everything you do for digital health and healthcare in general. Really appreciate all the work.
Thanks. Well, I mean, we're lucky to do what we do. It's a lot of fun to be part of such an important industry, right? So for those that don't know you, tell us a little bit about yourself and Ellipsis Health.
Yes, so I'm Susan Selinsky, and I've spent the bulk of my career in healthcare. I really believe that you can't have physical health without mental health. And so at Ellipsis Health, we're solving the mental health crisis by leveraging the unique power of voice to identify people in need and to connect them to personalized care. And we're the only clinically validated vital sign for depression and anxiety.
Wow. That was what was fascinating for me as I prepared for this interview. I saw on your website, you say, today there is no objective and scalable measure for the severity of anxiety and depression. And I saw that and I was like, it's true. There's all sorts of measures, but nothing that's objective. How do you see that, and how are you working to solve this problem?
Yeah, so what we use now are great tools. They're FDA-approved tools. We use a PHQ 8 or 9. We use a GAD-7, and they're called patient-reported outcomes. And we use these, and we expect people to have a certain reading level. We ignore their cultural backgrounds, their genders, socioeconomics. And so what we're trying to do is really bridge that gap. People don't necessarily want to fill out survey after survey after survey. And so the current state is that the only way to diagnose depression and anxiety is a lengthy in-person interview with an incredibly gifted behavioral health specialist.
Sure. And expensive.
Exactly. And so how do you screen? How do you help people understand where their mental state is? And so by using voice, we're able to actually solve that gap. And we believe it's really important. I mean, all of us know someone who's had depression or anxiety. It's either a family member, it could be a coworker, it could be even ourselves. Yep. So how do we take people where they are and really try to give them the care that they need?
Yeah. Well, and I think there's a lot of us that know people that we think probably have it and haven't been diagnosed with it. So that could be as big of a problem as those that are even already diagnosed. So you talked about voice. So tell us about the technology behind Ellipsis Health. How does it work?
Yeah, so we use about 60 seconds of natural voice answering open-ended questions along with machine learning, and we use both acoustic and semantic models. Okay. That's a little different than some of the other speech companies out there. We believe that words matter as well as sound, so it's really important to use both. And we can kind of fit into almost any place if you think about the healthcare continuum. And so we've been doing this since 2017. And we are just getting started. We spent a lot of time on the clinical and the scientific side getting ready for this moment.
Yeah, so I think it's interesting you talked about the acoustic versus the emotion. I guess that's sound inflection versus...
Acoustic is the sound, and semantic are the words, if you think about it. Yeah, so the words that people say as well as the sound.
So can you do that with anyone just casually as I'm talking to Alexa, or what do you need to be able to do this effectively?
That's a really good question. So we need a signal. Okay. So one of the things that we have learned is that not just any question works. So we have questions that are validated with the science, and we have an incredible chief science officer, Dr. Elizabeth Schreiberg, who's spent a lot of time, and if you look her up, you'll see that she has hundreds of patents in the speech area. So she leads an incredible machine learning team, and we spend a lot of time thinking about the right way to collect this information. And you need something that will elicit enough of a signal where we can run our algorithms. Gotcha. So billing conversations, for example, someone that was scheduling, someone ordering a pizza, we know those things don't work.
Interesting. So it can be casual if the right questions are answered. So maybe in a mental health appointment, you could assess it, but maybe not as I'm ordering a pizza. Interesting. Yeah. I love the technology. Yeah, so where is the opportunity? I mean, I get the idea, okay, we need to identify, potential depression, anxiety, those types of things. Is it going to be embedded in portals, or is it going to be embedded in apps? Like, where do you see the technology really being used? Are there some example use cases?
Yeah, so right now we do it two ways. One is inside of like a digital front door, and in that case, the user would be speaking to some kind of device, and we would have a microphone enabled where we're able to ask them questions and they respond to us. And that is something that we call human to device. And the other way, which we think is the larger potential, not just for us, but just healthcare in general, is layering on top of calls. So it's more passive. Of course, we do everything with privacy and consent, and that's a core value of our company. But if you think about it, if you're talking to a care management coordinator or any type of telehealth call, we're able to return back to the person that's leading that call an indication of the person's depression or anxiety. We're decision support, so not a diagnosis. Sure. It can be very valuable to the care model and change the pathway that person might go on. So our whole thought is there's a lot of silent depression and anxiety out there. And in addition, it's very hard to identify people. So if we can help get them care faster, then that's really our mission.
Yeah. Well, it's interesting. I come from a background where the health and counseling center were together. And so we treated the whole patient. We had all these conversations, right, where the counselors would train the clinicians that were seeing them for, a rash or other things to say, oh, well, how about we address the full person, mental health, but how do you do that? It sounds like, you're working to make that easier for them, using the voice. I can even see, I saw today, someone said that the 911 for mental health is just launching. You could imagine it being used in a scenario like that as well.
100%. I mean, again, I truly believe that you can't have true physical health without having strong mental health. And we overlook these things. We just don't think that, we don't understand the direct correlation. As we're going through and coming out of COVID, we're seeing more and more depression and anxiety everywhere. And we just as a country, as a culture, as a global community, haven't figured out a way to strip apart the stigma and misconceptions around mental health. And so, I think programs like you discuss where there's the whole person health, it has to involve an emotional and a mental health aspect of it if we really want to see the changes we say we all do in health.
Well, and the challenge that you described is that the doctor in that 15-minute visit that they have, often doesn't have time to even think about, are the mental health issues causing more trouble? So if you can give them some sort of indication, so at least they could refer them to some resources or things, that's an interesting way. A lot of clinical decision support doesn't streamline the process, it makes it harder. But in this case, it could actually streamline some of the efforts that the doctor makes. That's really interesting.
Yeah, and I also believe that if you think about the way we're structured right now, we keep on adding more and more to the nurse practitioner, to the medical assistant, to the doctor, and every day they're asked to do 10 more things.
Yeah, exactly.
And so how do we provide them with data and tools that can actually help them affect the care that they want? And to your point, in a 15-minute appointment, it's unrealistic to expect that they can see everything. And often I think that when you think about the care of an individual patient, it's not just the patient, it's also the caregiver. So if you're in a meeting, how are we also treating the whole family holistically, or even the children? Mental health isn't just something that affects one person, it affects the entire family. And if you've ever been in a situation with a coworker, everyone wants to run to help that person. So I think we're just trying to figure out what's the best way to catch them and provide them the care that's most needed.
Yeah. Well, I love that you're trying to provide some objective measures that could do this. So thanks so much for sharing about Ellipsis Health, and thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application.